Hi guys, and welcome back to my channel. I know it's been a while since I made a video, but today I wanted to come on here and share what has been going on in my life, and kind of give you a story of my lymphoma scare that I had recently went through. So roughly a year ago, I started noticing some swelling in the right side of my neck right here. At first it wasn't really painful. It was more of just annoying discomfort. I had noticed that it seemed to hurt more when I wasn't feeling well, or if maybe I had a little cold. So at first I didn't really think anything of it. This continued on for a few more months, so I decided to contact my doctor, and I went in for my doctor's appointment and let him know all my symptoms and what was happening. And he had decided to schedule a ultrasound just to make sure that it was nothing scary. So about 2 weeks later, I had an ultrasound on my neck, and they concluded that it didn't appear to be anything scary. It wasn't overly large at that point, so just to keep watching it and let them know if it was continue to be an issue for me. So at that point I kind of just let it go, didn't really think anything of it. But a few months later, I had noticed that my neck started to become more larger on that side. I did have a few viruses, so I thought maybe it was from that, so I just continued to ignore it. But then a month later, it just kept bothering me, so I did decide to mention it to my doctor again, and he just informed me that we'd keep watching it, but the ultrasound didn't appear concerning last time, so he didn't think that it was something that we needed to address at that time or send me to a specialist. So again, I just let it go. Like I said, same issue kept going on for a couple months. I actually ended up going to the ER one night. My neck was hurting so bad. I was in so much pain. Again, I thought maybe it was a virus and that my lymph node was just extremely irritated. So when I went to the ER, luckily it happened to be my normal doctor that was there that time. So when he walked in, I was extremely relieved because I just knew that he would take it seriously. And, you know, I just really love my doctor. He's always listened to me. So when he walked in at that point, he said, "So your neck is still bothering you, huh?" And I said, "Yes." And he looked at it and it appeared to be really swollen. He felt my neck, and the lymph node appeared to be rather large. So he ordered me an ultrasound on it. I waited a few hours and the results came back, and they didn't appear to be overly concerned with it, but at that point it had grown a couple centimeters. So I was extremely scared because I just personally inside knew that something was wrong and that this wasn't normal. I can remember I was crying, mainly to myself, just because I don't show a lot of emotion to people, but I just was scared. And so he had decided to refer me to an ENT. So that did make me feel a little better at that point. And then knowing that they had read the results and they weren't concerned at that point. But I went ahead and I scheduled that ENT appointment and I went home. It continued to hurt really bad, so I had contacted the ENT to see if they could push the appointment up earlier, and luckily they were able to, so that was a blessing. But I went to this appointment by myself thinking that it was just going to be a routine appointment and nothing concerning was going to happen. But hold on a second, my son's crying. All right, I'm back. Sorry about that, guys. But I went to this appointment, like I said, not feeling concerned, really. I went by myself, and I was waiting in the waiting room, you know, just like a normal appointment. The nurse called my name and brought me back to this room, and I thought it was quite odd because this room looked like it was a biopsy room, like in an ultrasound room. But I thought, well, maybe they're busy, so they just decided to put me in this room. When I had sat down, the nurse had informed me that they were going to be doing the biopsy today, and I was very confused because I didn't really know at that point that that's what was going to be happening. And she had informed me that she and the specialist had talked to my doctor, and they were concerned about this lump and the size that it had became. So at that point, I was shocked, and I wasn't really sure what to think or feel, um, as most people in that situation probably do or feel. Um, so I said, "Oh, okay." And I was scared because I had never had a biopsy done before, and I wasn't really sure what that all entailed. A few minutes later, the ENT doctor came in and informed me that he had spoke to my family doctor, and they had both came to the conclusion that it had became rather large. Excuse me, the lymph node became rather large, and that is something that they needed to do a biopsy on immediately. I then began to cry because I was very scared and concerned given my medical history and the things that I have gone through in the past, which I will make another video on all that. Um, but I then was told that they were going to do an ultrasound first to look at it. So he had me lay down back in the chair, and he wasn't really saying a whole lot, and that was concerning to me because I feel like if he wasn't concerned at that point, he would say, "Oh, you know, it looks like it's rather large, but it's nothing concerning." So I had asked, "Is it look concerning to you?" And he had told me yes. It is an odd shaped lymph node that appears to be lymphoma. And immediately I just went numb. I wasn't really sure what to think at that point. I was extremely scared, and sorry, this makes me very upset at this point. I kind of went in a daze, and I wasn't really sure how to react. I did start crying, and this doctor was wonderful with me. He was super comforting, let me know that, you know, he understands that I'm extremely scared, but they weren't 100% sure at this point, but he had, by the looks of the ultrasound on my neck, it looked to appear that it was lymphoma. And so at that point, I was 100% sure in my mind that I had lymphoma. And I knew nothing about lymphoma. I don't have family history of lymphoma. I don't know anybody of lymphoma. So the word lymphoma in cancer is very scary, as most people know. And I wasn't sure how to react. But to cry to the doctor and tell him that I had 2 babies at home, and I couldn't go through this. I've had a tough year medically, and he said, "Yes, I saw that in your charts, and I'm very sorry to hear this, and I'm sorry that you have to go through this." And so at that point, he told me that they were going to do a biopsy, and I was so numb that honestly I don't really remember the biopsy because I just felt like it was an out of body experience at that point for me. Um, he had inserted a needle twice into that area, and when he was done, he said, "You did that very well. You did fantastic." And honestly, I just wanted to tell him that I just don't feel like I'm here right now, and you know, I just really didn't have much to say to him at that point, except to totally break down because I was there alone, which was my fault because I didn't think that I needed anybody at that point to be there. And also my husband had to work, so I explained to him, what am I supposed to do? You know, what are my options at this point? And obviously I was thinking too far ahead, but that's just the kind of person that I am. So with all those questions, he did tell me, you know, you can have lymphoma for a very long time, and that he didn't feel like I was going to die from this if it was lymphoma, and that I would have to go through chemotherapy and all of that, and but he, you know, assured me that I would survive, and that the percentage of people dying from lymphoma is pretty low. It can happen, but it's pretty low. So that did give me some reassurance. But like I said, the thought of having lymphoma and cancer is very scary, to anybody. And my heart goes out to anybody that goes through this, or has family that goes through this, or kids that go through this, um, or is currently being told that they have lymphoma, because I know what that scare is like. Anyways, at this point, they had me leave and told me that in 10 days they would contact me with the results. I remember I called my mom hysterical, because we both really just thought it would be nothing. And my mom was in complete shock, and she felt really bad that she wasn't there for me. As well as my husband. I called him. I didn't really want to tell him on the phone, but I really didn't have a choice because I was hysterical. But I remember driving home, and I just felt like I don't even remember driving at this point, which is probably not good. I was extremely scared. I wasn't sure what to think at this point. I was just dreading the 10-day wait of what my results would be. So I went home. I was a mess for a couple days. High anxiety, wasn't sure what to think. And I eventually called the doctor about 8 days later, just because I really wanted to know if maybe the results came in early. And the doctor answered the phone, and he informed me that the cells don't appear to be cancerous, meaning that the cancer isn't somewhere else in your body that has spread to your lymph nodes. So that is good news, and that did make me feel a lot better. But that he thought the best option at that point was to remove the lymph node in my neck that was growing. And I did agree that it was the best idea to take it out. So we scheduled that procedure for roughly 10 days later after I had spoke to him. I still had a lot of high anxiety, as you would expect. I remember the day of surgery arrived, and I was just extremely nervous, very emotional, also numb at some points. I just really wanted to get it out because I was just very concerned. The procedure, went pretty well. I did get to cut about 4 inches on my neck. I remember they told me they had to put a tube in my neck, which you probably saw in the beginning of my video when I put pictures in there. I had that in my neck for 2 days to help drain it, because when you get your lymph nodes removed, you have a harder time with swelling and having a spot for your drainage and infection to go. So I had that in my neck for 2 days. That was very painful, and they did leave it uncovered, so it was very scary looking. I did not like having no bandages over it. It just made me feel high anxiety at that aspect. I was afraid that my kids were gonna pull the tube out or, poke my neck, and obviously I was in a lot of pain too, so that wasn't very helpful. Recovery for that hasn't been very bad. I'm actually doing pretty well now. I still have a lot of swelling in my neck at this point, but when I ice it, it's okay, and if I tend to rub it a little bit, it kind of moves the fluid out, so that has been very helpful too. But again, after the procedure, he let my mom know, because she's the one who took me to the surgery, that it would be probably about 10 days before I would get a result back. So again, about 8 days in, I called the office because I was just very anxious, and they had informed me that they had to send it off for a second biopsy to a cancer, more of a cancer study center. So I was extremely scared at that point, because I was like, oh no, I hope they didn't find something. But I guess that's pretty common for having a biopsy on something that's removed, because they want to be 100% sure that it's not cancerous or something dangerous. So I had to wait another 10 days. So it just was a really long process, and a very scary process for me and my family. So I went back to the doctor about 10 days later after I had spoke to them on the phone, and I was very anxious, very, very scared, because I truly thought in my heart that I was going to get devastating news. And I know everybody else was extremely positive, but for me at that point, I just had a super bad feeling, and I wanted to prepare myself for the worst. And I went into the room, you know, thinking that I was going to hear something I didn't want to hear. And the doctor came in, and, you know, sometimes it's really hard to read doctors. And he sat down and said, well, your results have came back and you do not have lymphoma. And I can remember this weight just coming off my shoulders, and I just wanted to cry because I had been high anxiety for so long and so scared of what my future was going to look like. And actually I was very shocked because he was almost certain that it was lymphoma by the look of it. And he had told me this that day as well, that I am very surprised by your results, that you do not have lymphoma. But, you know, I am glad to be wrong at this point, and you are very lucky. And so I wasn't sure how to react, but I was super, super happy, and I wasn't sure I wanted to believe it at first because of all that I had went through, and I was afraid that maybe they had missed something. But, you know, he had reassured me that they did all the tests possible to make sure that it wasn't lymphoma, and they found nothing. And they weren't exactly sure why my lymph node had grown to the point that it had grown and why it looked the way that it looked. That kind of made me nervous, though, but they weren't sure on that. But honestly, I wasn't very surprised at that point because of my history and all the weird things that have happened medically in my life. But I was, again, super relieved and super happy. And I remember calling my family and telling them that it was not lymphoma, and everybody was super happy as expected. So now at this point, I am just trying to recover, like I said, from this nasty cut on my neck, and all the swelling. But, I just wanted to get on here and share my story and my experience and let everyone know that not all things that doctors think that appear to be cancer are not always cancer, and that to always stay positive and, you know, just hug your loved ones, and that there's not always a bad outcome for a biopsy or a cancer scare. And I also want to let you know, to those who are currently going through bad news of a biopsy, that my heart goes out to you, and I just want you to know that I think of each and every one of the people that go through this type of situation, because I know how scary that must be for you and your family. But thank you so much for watching and listening to my lymphoma scare story. And please continue to watch my channel, and I will share with you my scary experience of my blood clot history of the past year. Thank you so much for watching. Thank you.